Afternoon, everyone. My name's Lauren Ellerman. I'm obviously not in the office today and certainly not ready to go to court in my overalls, but it's snowy and icy, so we're working from home. This week alone, we've received, so we are a medical malpractice, nursing home abuse firm, serious personal injury law firm. And this week alone, we've received probably about 4 or 5 calls from family members whose loved ones are either in the hospital right now or in a nursing home or an assisted living facility, having recently been diagnosed with COVID. And, here we are 11, 12 months into this pandemic. We know it's still happening, even though numbers are dropping. And the folks that call us still have the following 2 questions. Number one, is there anybody I can hold sort of responsible for my loved one in the nursing home giving COVID? But then the second question is, what do I do? How do I take care of my loved one? And I'll answer the simple question first. There's no way you can hold anyone legally responsible for your loved one getting COVID in any kind of healthcare facility in Virginia because of Executive Order 60, which I actually think is a good thing. I don't think that we should hold healthcare providers responsible for COVID when none of us knew this was coming. It's really difficult to treat and to handle and all of that. But the more practical question is, if you have a loved one who's in a facility and they've gotten COVID at the hospital, they've gotten COVID at a nursing home, what can you do about it? Meaning, how can you protect your loved one? How can you see your loved one? Is visitation still off? And we are fielding those calls all the time. And the basic principle right now is that every facility gets to decide what the visiting rules are. So if that's a hospital or if that's a nursing home, they get to decide whether or not you are allowed to visit your loved one, regardless of whether they have COVID right now. There's no federal laws that say you have a right to visit. So if there is someone who has COVID and maybe it's a life or death situation, most hospitals will allow you to appeal to a hospital administrator that you could come be with a loved one before they die, but not everyone. So then the question is, what if your loved one survives COVID in a nursing home, but you really want to see them? What do you do next? And the sad answer that I'm giving everybody is get them out. Get them out of that nursing home. If you can prevent anybody from going into a long-term care facility right now, do it. And that's assisted living or long-term care. Currently, right now, that kind of close quarter living condition with the kind of staffing that most of the facilities have are still COVID hotbeds. So we encourage people, if there's any way you can avoid long-term care right now, do. We get a lot of the following call. My mom's in her 70s. She fell at home. She broke her hip. She had surgery. Surgery went great. Everything at the hospital was fine. But then they said she had to have rehab, and so they sent her to a rehab facility. Your mom does not have to go to a rehab facility. Your mom can get physical therapy in her home. Medicare will pay for in-home therapy. There's absolutely no reason to agree to inpatient rehab right now if you can avoid it. And that's just across the board, whether it's speech therapy, occupational, or physical therapy. Medicare will pay for those services at home. Now that means you need to be there too, and a lot of families can't do that. But unfortunately, with COVID still rampant in long-term care facilities, you really don't have any choices except to try to keep your loved one out of the facility or get them home as soon as possible. And I know that's heartbreaking. It's absolutely awful to, watch a loved one decline. It's even worse not to be there with them during that decline. And the last question that we're getting all the time is a communication question. And it's primarily from folks who have loved ones in nursing homes, and that is, the nursing home is not calling me and telling me that my loved one, how she's doing, or, I feel like I have to harass them to get an update. And again, the answer is you do have to harass them to get an update because they're understaffed right now. Because if you can make the same amount of money bagging groceries at Kroger that you can working in a nursing home, which is what most CNAs get paid, just slightly over minimum wage, then absolutely you would work at Kroger, which means these facilities don't have enough staff right now. They don't have enough staff to provide care, and they don't have enough staff to field your phone calls. So I know that stinks and it's heartbreaking, and we all hope and expect better from long-term care facilities, but the truth of the matter is, in the middle of a pandemic, you're not going to see better. So if you can avoid your loved one going there at all, do it. And I hate to be the bearer of bad news, but that's what I spend all day, every day when I'm in the office dressed better. telling people, which is, you have to be your loved one's advocate. We're all in this together. It stinks for everybody. But if there's any way your loved one, you can avoid putting them in long-term care right now, even for rehab, you should do it. Because unfortunately, we're seeing it, COVID fly through assisted living and nursing homes. A vaccine's not going to change that because staff may be new and maybe they don't get to be vaccinated as soon as they start working. And of course, as the residents turn over, then it increases the risk of COVID hitting the facility. So this is just a little bit of a PSA because we get this call all the time from desperate people across Virginia on what they can do for a loved one who's in a nursing home right now, either with COVID or that kind of thing. And unfortunately, it's just a tough situation. So if you have any specific questions, you're welcome to call our office. Thanks, guys. Appreciate it. And be safe. And thanks for the ladies I know that are watching. Bye, guys.